Troy, what problems do you have before the procedures?
Well, before the procedures, my quality of life was really difficult. I, had trouble doing normal working activities, and just not being able to sleep properly, not being able to sit in one spot, for long periods of time. Real irritable, headaches, here and there, and a lot of body aches, stiffness, and soreness. So it helps out. It helped a lot. I wouldn't wish this on anyone.
So mainly it was your back pain?
Yes, my lower back.
Was it radiating to the legs?
Radiating through the leg, through my toes, the bottom of my heel, and it do shoot through my knee and the buttocks area.
Now you were telling me you couldn't sleep, that you couldn't exercise. Could you elaborate a little bit on that?
Well, I guess at night, when you daily activities finally come down and you go to relax, I got a lot of throbbing and just being very uncomfortable with me getting a good position to go to sleep. I would shower, drink warm tea and try to get myself, relaxed and calm. But I mean, every 2.5 to 3 hours, like you're up, constantly.
And exercise, why you couldn't perform any exercises?
Well, with the exercises, I couldn't do exercises, but I couldn't exert myself. I couldn't overdo it. If I did, then it's like anything else. It really starts bothering you a lot, to where you need to take a break and rest and just
Guiding the small needle into the left L2, L3 foramina. And as you can see, the needle is going slowly and very carefully. At this time, are you feeling any pain or just pressure?
Pressure.
Pressure, okay, but not pain. Okay, here we go. A little more pressure you're gonna feel. How's that?
Pressure.
Good. So I got good news for you. The needle is there. So I'm gonna go now to the next level, which is gonna be the L3, L4 level on the left side. Now this is the pain that you get in the back, the buttock, and it goes into your left hip.
Dr. Roque, what procedure did you just did of this patient?
Okay, this is what they call a fluoroscopic guided L2 and L3 selective nerve root injection. And so basically what I'm doing, I'm actually putting a small needle inside the foramina and on L2 and L3. And as you can see here, you could actually see the contrast highlighting the foramina. You could actually see the nerve root coming down, and you can see contrast inside the epidural space here also. You can see it on both. This is a 41-year-old patient that came in with severe low back, left buttock, left hip pain after being involved in an accident at the work. And this is one of the procedures that we do to diagnose that he's got radiculopathy, which is, in other terms, is nerve compression at the L2 and L3 level. So I did a diagnostic injection. Hopefully he'll get much better. The next couple of days I'll do another evaluation. And if he got better, what I would consider down the road is to do a discogram and find out exactly where that nerve root is being irritated, or I would do a nerve conduction test just to document the problem.
Dr. Roque, what kind of procedure did you just perform on patient Troy?
Basically what I did was lumbar L2, L3, left-sided, selective nerve root block. And so basically it's very simple. The patient had a severe left-sided low back pain traveling into the left thigh anterior portion. So basically what I did, I put a needle at the L2 foramina, and I was able to put medication there to relieve the inflammation. It was done at L2 and it was also done at L3 at the same time. And the patient was able to go home without any complications. Today he called me, he's feeling much better. So I'll do a follow-up visit next week and we'll evaluate to see if we can repeat the procedure.
What is the purpose of putting that anti-inflammatory substance inside the canal?
Again, you have a lot of inflammation, very minimal space for that inflammation to spread. So it's actually compressing the nerve root. The patient's getting the severe leg pain. So you're basically adding the medication in there and then reducing the inflammation. Therefore, you're decreasing the pain.
And all this procedure is done under fluoroscopic image.
Absolutely. There's only one way to do it. This way, you reduce the risk of complications. So in his case, everything was uneventful. A couple of minutes of injecting on the L2 and the L3 foraminal.
So that's the reason that it's called selective foraminal block.
Exactly. What I do is I compare this to an army sniper. You're actually, instead of putting medication all over the spine, you're actually selecting the nerve root that is causing the pain. So you're able to target, and the word is target, the nerve root by putting medication there, instead of just shooting medication all over the spine.
That's what they do with the lumbar epidural. So basically,
Yeah,
you're being selective.
Exactly. Lumbar epidural is a good procedure, but again, you're just using too much medication, and the reality is you're not hitting the targeted nerve root. The other thing you always have to consider when you do this kind of procedure that you're going to be precise. So in other words, I inject the L2 nerve root, the patient's pain disappears. I know now that the problem is here, not any place else.
Troy, how are you feeling after the procedure?
I feel better than before. A lot of the stiffness and the throbbing and the numbness has subsided right after. Still a little sore, but overall it's a lot better than what I felt before.